Okay, so welcome to Policy Systems and Environmental Change, Approaches to Health Promotion. Today's webinar presenter is Dr. Susan Geckler. Susan Geckler is the Chief Executive Officer of Directors of Health Promotion and Education. She oversees the day-to-day operations of the national office and represents the association, its members who work in state health departments on health promotion and health equity, and in the field as part of consortia and coalitions, in contracts with the media and in advocacy work. She's also consulted on curriculum development and her area of professional expertise, as well as on grant writing and short-term projects. She's presented at national, regional, state, and local school health-related conferences and has co-authored and co-edited several school health-relevant publications. She has a bachelor's from Case Western Reserve University, a master's in health education from University of North Carolina at Greensboro, and a PhD in health education from Temple University. Dr. Geckler, welcome to today's presentation.
Thank you very much, Cheryl. I want to start out by making sure that everyone knows who is on the webinar. And Cheryl, I don't think there. So I believe that the people who are on the webinar are program staff who are from community agencies or organizations that were selected by either the American Heart Association, American Planning Association, or the National WIC Association. You are, for the most part, just coming into the project. We have another cohort of program staff who have been on the project for a year now, but this is for the newly funded organizations. From the registration list, we believe that most of the people on the call are from the American Planning Association. Each of the communities or organizations that are funded to do this work are to select one or more of the following: either improving access to nutritious foods and beverages, access to physical activity opportunities, access to tobacco-free environments, and access to care for preventive services. Among those with the American Planning Association, I believe, at least in the first cohort, all were either addressing nutritious foods and beverages or physical activity opportunities. So most of the examples that we will use today are focused in these areas. First of all, why we're going to do this. First of all, this particular funding requires that people use policy systems and environment approaches. But part of the reason for that is that it is considered the best practice for maximizing the number of people affected. And that is the hope in this project. Another thing is that PSE changes or improvements are likely to be sustained even after funding ends. And that makes them generally cost effective. If you consider traditional ways of doing health education, often they were one-on-one, classroom-based, or counseling sessions within providers' offices. So they affected a small number of people, could be highly tailored, but because this is a public health approach that we're doing, we want to affect large numbers of people. One of the advantages of PSE approaches is that it's often what we call passive health promotion, so that it doesn't require the individuals affected to make decisions individually on what actions they're going to take. But it's usually that there are changes that affect large numbers of people and require less initiative by each individual within that domain or where it is. An example of a PSE approach that we're trying to counter is in the tobacco industry. Tobacco does not bring 30 kids into a room to teach them how to smoke. Obviously, they try to change norms. They try to affect large numbers of people through a variety of activities that they might do. So let's look at each component when we talk about policy systems and environment change and what it is that we're talking about specifically. A policy is a written statement, usually one that is binding. It can be implemented or enacted at various places. Organizationally, it could be in a work site, it could be in a school, it could be in a church, it could be within a park. So it has a variety of applications. It can also be in the professional realm, so it can be setting standards for acceptable practice. It can also be governmental, and that can occur at the local level as well as the state and federal levels. Some examples of policy are workplace rules, insurance provisions. When we say limitations that businesses would accept would be something like beverage distributors deciding to remove sugar-sweetened soda as vending machine options in schools, or restaurants deciding to make their establishments smoke-free. Local ordinances, joint use agreements, this would be things such as allowing the use of school facilities for community programs. Governmental can be school boards. There can also be at the local, state and federal levels, talk about guidance, regulations, and laws. These are often written, so there might be state guidance. That's not, doesn't have the force of law. It says these are recommendations. State regulations actually have the force of law, although they were written by those people who are in the executive branch rather than the legislative branch. State laws, which are laws that were enacted in the legislative branch. And that can be at the state or the federal levels. Some examples of policies in the areas that we're addressing. In tobacco prevention, could have smoke-free indoor air ordinances, or it could be a policy of an individual business. It could also be taxation. We know that if there are taxes on tobacco products, that the usage decreases, especially among young people and people who are lower income. The physical activity policies, it could be getting health insurers to give discounts to people that are covered by them to use at fitness facilities. It could be joint use agreements, which we mentioned. It could also be that a workplace would allow flexible time so people could take longer lunch breaks to be able to do some exercise or physical activity at that time of day. Some examples of policies in the nutrition area, partnerships with grocers where they would agree to accept certain types of payments, where they would agree that certain kinds of foods would be featured. There could be institutional procurement policies by hospitals, by schools, by prisons, any places that serve foods to the public or to their constituents. People can do healthy meeting pledges. That's something that I know the American Heart Association has taken a lot of leadership on, something that the Directors of Health Promotion and Education, DHPE, that I represent, has taken, so that when we have a meeting, we try to ensure that anything that is served in food is healthy, but also that there are physical activity breaks, and that we try to be environmentally friendly. The options of what's allowed to be in vending machines is another type of policy. There could be changes in food preparation requirements. So, for instance, in many schools, there are requirements that foods be baked rather than deep fried. And there can also be things such as land use zoning. I want to be clear that when we're talking about policy, we're not talking about lobbying. And this cooperative agreement, anything we're using federal funds, and these are ultimately federal funds, does have restrictions in terms of prohibitions against direct lobbying of people who are in legislative bodies or regulatory bodies using the federal funds or using the time supported by federal funds. There will be another webinar and also at the TA workshop that we'll be having in April, there'll be more information and more specificity about what is lobbying and what is allowed and what is not allowed. So we talked about policy. Now I want to talk about systems. And although we're talking about them independently, they really are not independent, because policy, system, and environment themselves are parts of a system. So as an example, in Fresno, California, which is in a area that has a lot of agricultural production in the surrounding area, a group of people who were interested in obesity prevention discovered that there were no farmers markets in Fresno itself, and they wondered why. When they began to look deeper into the situation, they found that the zoning requirements, zoning regulations, prohibited farmers markets as an acceptable use, or did not include them as an acceptable use. So they needed to change the policy, so they worked to get the policy changed. Once the policy was changed, however, then there needed to be systems in place that would allow the implementation of the policy. So even though they knew that there was space available, land available, they discovered that there was not water available in many of those places. So now they had to get the utilities people involved in order to implement, and that required a systems change. And the systems change resulted also in environmental changes in terms of having spigots, having infrastructure, and other environmental changes. So it's not that these pieces are independent, but often a change in one has implications or changes for others. So that's why we talk about PSE approaches, and although we're defining them separately, they're not really separate. So a system is a group of interrelated and interacting objects or people. It can also be organizational procedures, such as personnel policies, personnel allocation, other resource allocations, what programs are offered, what processes are followed, such as how food is prepared. So a systems approach requires sort of defining what are the parts, what pieces are part of the system that you're defining. Systems are human defined. They're not something that exists in nature. An interesting recent example in science is that in the solar system, which we might think is something that exists, what is included is changing. So what we thought was a planet, Pluto, has been excluded, and now they think there might be another planet. So we have to know what all the, and they are defining that because they see some interactions, some changes in orbits that they can't explain, and so they think there must be another part to the system that will explain why they're seeing what they're seeing, because something is interacting. So, but you can't, when you're trying to approach a particular problem or particular intervention, do everything. So you need sort of to set the boundaries for what you're going to do. What is part of the system, what is outside the system that you're going to include for this particular intervention. And part of that is understanding interrelationships. So the example that we gave with Fresno, when you started bringing together all the players that needed to be part of the picture for the farmers markets, they had to bring in some new partners and identify a new part. And this can help identify the partners that you need to have in a coalition. So just as an example, if we look at this diagram of a food system, it identifies one system, and that system has the farm producing the food, the transportation from the farm, the processing of it, the transportation from the processing plant to a store, people eating it, composting it, waste. There's also going to the local markets. Well, if we decide that what our plan is to do farmers markets, then we might want to define our system here and exclude these parts of it because those are not relevant for this particular issue, even though they're part of the food system broadly. But then we might say we need to bring in others, such as the utilities. So what we're looking at, how we define it, is important for identifying a coalition and looking at how pieces are interacting. I want to give another systems approach example, and this was from Columbus, Ohio project that was an APA-funded organization, and it was the city health agency that was funded. In their project, they decided in a limited period of time with limited resources, rather than trying to create something brand new, they were going to use an existing coalition and really apply a systems approach to identifying what things were already there that were working on physical activity, improving access to physical activity opportunities, and finding ways to integrate them. What they discovered at first was that there were a bunch of programs and projects in the city, many of them very well done, but they were each sort of in their own silo, not working together. So in bringing together their approach, what they tried to do was say, okay, we're going to be the coalition, we're going to apply PSE approaches, and we're going to look at all these different cogs and see how do they fit together and how do they interrelate and how could they interrelate. So one of the programs was with the Y, a WISE Move program that provided instruction, coaches, and resources, facilities for improving physical activity. They were also trying to engage businesses and making businesses physical activity friendly. But they realized that many local businesses did not have the facilities for being physically active in a gym or some kind of facility, and didn't have the human resource or capital to provide activities on site. So, as this PSE approach, they said, well, you two should link together, and then you can provide either having the Y come to the business or at the business giving vouchers that could be used at the Y so that they could take advantage of the resources that were at the Y in order to accomplish what the businesses were trying to achieve. Another cog there was the transit system. Many of the businesses wanted to encourage biking and walking to work or using public transit, but they had to work with the transportation system then to see what the possibilities were. How could they improve sidewalks or get bike lanes or something like that, depending on where they were located and what the barriers were to that. So this was the approach that they were using. It was a systems approach. They didn't really need to change a policy, but they just were trying to integrate more for the project that they were doing through this cooperative agreement. So we talked about policy, we talked about systems, and now to talk about the built environment. And for those of you that are planners, probably a lot of you are working in this area. The built environment is the sort of where people live, work, and play and learn. Examples include physical structures as buildings, as well as streets, parks, and also transportation options. And a historical example of environmental change approach, which you might or might not be aware of, happened in the mid-1800s. There was an outbreak of cholera, and John Snow postulated that the source of the epidemic was a contaminated water supply coming out of one particular tap. And he couldn't convince people not to use that tap. So eventually he got permission to take the handle off the pump. Now people had to go someplace else to get their water, and when they did, the outbreak stopped. didn't require individual decisions. It was an environmental change. Didn't even require a policy change or much of a systems change. So some environmental changes don't even require a policy. Some do. Some are the result of a policy change. Some examples of environmental changes that you can often do just by taking the initiative are improving a stairwell. And I have to say, I used to work at CDC a long time ago, and even the before picture here wasn't what it looked like when I was there. It was not painted at all. It was very dingy. It was very uninviting, and you almost felt like you were taking your life in your own hands to go there. So now they've painted, they've used artwork, carpeted, have music, rubber treads, and so people are using the stairwells. But they also did more than that, trying to change the corporate culture and discouraged people to use the elevators. So by the elevators, there were signs, did you think about using the stairs? CDC does have a built environment assessment tool. So if you are working on needs assessment and you're assessing your community still, this might be something that would be useful for you. The tool includes several subsets of tools. So there's one on the built environment infrastructure, there's another one on walkability, one on bikeability, recreation sites, food environment. Each of them measures the core features and qualities of the built environment that affect health, walking, biking, and other types of physical activity. So the built environment infrastructure looks at road types, cut curbs and ramps, intersections and crosswalks, traffic control, public transportation. The walkability looks at access to safe, attractive sidewalks and paths with inviting features. The bikeability looks at the presence of bike lanes or bike paths where you can park bikes safely. The food environment looks at access to grocery stores, convenience stores, farmers markets. So, and you can add questions or modules if there's something that you want more information about in your own assessment. So that sort of gives you a piece of what are the individual pieces, policy, systems, environment, or change, and I talked a little bit about how they interact. Change Lab Solutions, which is an organization that's done a lot of work in this area, has identified 8 elements of strong prevention strategies that all sort of relate to what a good policy, systems, environment change approach should be considering. First of all, being data-driven and grounded in the community. That's why part of this project is asking for a needs assessment. It should be ambitious yet politically feasible. So is it something that in the time frame that you have and given the political climate of where you live, that this is something that is doable? Is it financially feasible? Do you have enough funds? And in long term, is it sustainable financially? Will it generate revenue? Will it continue to cost? Is there a plan or ability to do implementation and enforcement, and who is going to do that? And are those systems in place or those people in place? Is it legally feasible? If it's not legal, then it's probably not going to be good. And an example would be you can't restrict advertising for just tobacco or just sugar-sweetened beverages because that's a restriction of free speech. Does it address health disparities? And I think that's something that is also part of this project, but something that all of us are concerned about. You don't want to do something that's going to adversely affect especially the most disadvantaged communities already, and is it going to hopefully help those communities? Can you change people's expectations? Part of the example of this was the elevators and stairways in the CDC example. And finally, it should be one piece in a larger puzzle. So no one intervention by itself is going to make a huge difference in the curve of chronic disease incidence, but each piece combined, the additive effect, should have those effects. So when you're using a PSE approach, how you define the issue is important. You should consider various options, which are the most feasible, considering what we talked about: political, legal, financial, time. When you're forming a coalition, how are you defining the system that you want to modify? What components are part of that? Who do you need? And then are you addressing varied communities? And I know that the time is about up. I'll just do, we had questions at the end that I think I will skip, but I will do this, just a couple more. So we talked about varied communities, and this is just a little diagram that shows in one community there were two options, one related to walking to school and one in terms of offering school breakfasts. And they interviewed 3 immigrant groups about the 2 proposed solutions to get an idea of what the barriers might be and what might be acceptable in those communities. And there were items that were true in the individual level or family level, such as their beliefs about walking or their fears about children being alone, about whether families should be eating together or whether it was okay for them to be separate. At the neighborhood or community level, concerns about abductions, about violence by walking to and from school, and there might be religious or community concerns about the breakfast. Would the food, if there are prohibited foods and the religious values of a certain community, would those be respected in what was being served? The institution or the school itself might have some concerns about start times, school closures, what happens with bus policies, and whether there are cultural options. What happens if the buses are late, needing supervision, and so there might be staffing issues. And then the built environment has some issues also. What's the traffic flow like around the school? Is it safe for children to cross the street? Are there paths? What about when it's dark? Will they be going to school, walking to school in the dark? Is it hilly, etc.? Each of these are addressable, but if you're not thinking about how they interrelate, what the issues are in the community, then it's likely that what you're trying to do won't be achievable. So I think, given the time, since this was only to be a half an hour, we were just going to do a few poll questions, but rather than actually do them as polls, I'll just sort of run through them so you can, on your own, look at them, and I think you can answer them probably pretty readily without my talking about them. So I'll just show them, and you can think about them as sort of seeing the differences between PSE approaches and more traditional or more individualistic approaches. And I do want to make the point in all of this that PSE approaches are one piece of the puzzle that we talked about. But to make an impact, there have to be the cogs as well as the meshing together. So there do need to be programs that are in place also, and those need to be high quality. That's not what this project is about, but it's not that this project is, that this approach is the only approach or the better, always the best approach. It's often the piece that's missing, and so that's the focus here, because we need both, not either or. In this webinar, I'm not trying to say this is the particular intervention, this is the particular approach that's right for your community or for your project. Each of the what we call category A's, so the organization that you're working with or affiliated with has its own priorities, and they will work with you on selecting the specific approaches that are right for your project. And I think it's time for discussion. I know that you have examples, and it will be helpful to share and to learn from one another. Wanted to share, there is an excellent example of another YouTube webinar that was done by ChangeLab Solutions that I mentioned a little while ago that shows a lot of examples in the community level that you might enjoy watching. So at this point, I believe that sort of the opening it up for questions. So if you can open it so that people can ask questions, that would be great.
Okay, thank you, Susan. Okay, it looks like we have a couple of questions. Let's see here. Okay, one of the questions that we have, someone is asking you to elaborate a little bit about the free speech that you mentioned earlier in terms of when you are, I think it was under the
legal
parameters for, right.
Yeah.
Okay.
If an ordinance were passed that prohibited only one, that addressed only the content of advertising, so it could, if it were about tobacco only, you couldn't have an ordinance that prohibited that. You could have ordinances that addressed any type of advertising, billboards or whatever, but you can't prohibit the content because that's protected under the free speech amendment to the Constitution.
Okay. If others have questions, just a reminder, you can type your question either into the chat box or in the question box, and we'll address your question next.
Also, if you have examples that you would like to share with others of approaches that you have seen that worked, that you are considering, that you would like to think about, it would be good to share that. Doesn't have to be a question.
So for anyone who wishes to share, there's an option to raise your hand. It should be located near your name in the box. If you want your line unmuted and wish to share at this time, you can either do it by the chat box, or if you want to raise your hand, I can unmute your line for you. Okay, Susan, while we're waiting to see if anyone else has a question, one of the things that you did mention was that sometimes PSC change approaches take place as a change in a system or a policy or an environmental change. Sometimes they take place where a change in one thing prompts a change in a policy might require an environmental change or some combination of one of the three. In terms of preparing for an approach that will last beyond the scope of a project or last over the long term, what considerations should people make when they're pulling partners into the picture?
Well, first of all, you have to decide how are they interacting with whatever type of change it is that you are hoping to achieve through this project or improvement that you're hoping to achieve. And sometimes bringing in new partners, will change actually, because it changes the system that you're working in, how you approach it, and give you new insights. But it can also, once you have a coalition going and you establish the partnerships and parameters, often those relationships are going to continue on whether there's funding or not, if each of the parties finds that it's beneficial to them. So in the example of the COGS, even without the funding, now that the business and the Y are working together, they probably will continue working together as a sustainable partnership, because it's in their mutual interest.
Okay, Susan, it looks like one more question has come in here. In looking at increased access to produce in food deserts, we're working on 3 strategies. One is Healthy Corner Stores pilot program. 2, ordinance amendments to allow produce to be sold from push carts and mobile markets, and establish pilots for those.
Those are great ideas. So, there may be prohibitions now about doing push carts, and so you may have to get some policy changes to allow it. And then once it gets allowed, then there probably have to be systems set up for, is there a need to regulate who can have a push cart for food safety, for instance. Will there be taxation if there are local sales taxes? Will the people with the push carts accept the SNAP or WIC as payments, and will they have to set up credit card processing? So some of them have environmental aspects also, in terms of where it would be safe for the carts to be, so that they're not interfering with traffic flow. So, it's a great example. The corner stores, similarly, it might be getting them to understand what the requirements are so that they can accept SNAP and WIC, and then they need to be able to have fresh fruits and vegetables available. But one of the issues in small areas often is you don't have high volume turnover. So what are you going to do to reduce wastage, so that there's a fast enough turnover of fresh produce that they're not losing money on it? So all of these, you get the policy, and then there are systems that need to be figured out, which often have environmental aspects to them. Those are good examples.
Susan, one of the things you mentioned was the importance of actually defining what the problem or issue is that people want to resolve. Can you talk a little bit about that?
Yes. If you're saying that what you wanted, that you've identified your community, you've done the needs assessment, you know the local data, and for the example that was just given, what you found was that there is a lack of access to fresh produce. Now you have identified the problem, and you have defined a territory or a boundary geographically where you are going to be, where you did your needs assessment, where you determined that need existed. Once you do that, then you can begin looking at what is the community, what is available there, And that boundary setting, that identifying the problem, will make a difference in how you approach it. If you had the same community and what you found was that there were lots of fruits and vegetables available, but the problem was that people couldn't access them because there was a major highway between where say a farmer's market was and where there was a housing project, then your access is to fresh fruits and vegetables might be bottom line same, but the reason that there's a problem with access is different. So what you're going to do for your solutions is going to have to be different because of what you found and how you identified what the problem was.
Okay. Last call for questions. We have Dr. Susan Geckler on the line from DHPE. If you have questions about PSC approaches or wish to share anything about the intervention that your community is going to be implementing over the course of the next year or so, please feel free to share. Okay, Susan, I'm not seeing any other questions in the box at this point. Perhaps a few minutes to summarize, and we may end a little early today.
Okay. Well, as I said at the beginning, when we talk about policy systems and environmental change approaches, we're not talking about them in isolation. The whole idea of policy systems and environment change by itself, within itself, is a systems approach to looking at issues. And it's not that programs are not important, because they are important, but that what we're doing in this particular project is looking at it broadly. So to do that, clear identification of the problem that you want to address, what the issues are in that problem, what are the barriers that are identified so that people are not already doing what it is that you would like them to be doing. And then once you've sort of identified the problem, who needs to be part of the system? What are the pieces or components in order for that to occur? And do you need to start with a policy, or are our policies already there? Is the issue implementation of policies? Is the issue something that can be done without a policy with just an environmental change? And it's getting the resources and getting the attention to that. So there's not a solution, there's not an approach, but it's a way of thinking about issues and solutions that may be different for some people than how they have approached them in the past. Thank you all, and we're standing ready at both the organization that you're receiving support from, as well as there are two organizations, the Directors of Health Promotion and Education and the Society of Public Health Education, that's DHPE and SOPHE, who are charged with providing training and technical support for those of you who are working on these projects. So if there are other areas that you have questions, other areas where you need support, please feel free to ask the people that you are working with directly, and they can reach out to us and will for additional support as needed. And so we wish you the best and look forward to meeting you all in April when we have our technical assistance workshop.
Okay, to everyone on the call, just a reminder, we will make the slides and the recording for today's webinar available for later viewing. And Susan, thank you for a great presentation today.